Today's topic, anemia, everything you need to know. SDG 4, also known as quality education, aims to ensure inclusive and equitable quality education and promotes lifelong learning opportunities for all. This goal emphasizes the importance of education in fostering a sustainable and equitable world with a focus on access, equity, and the quality of learning for everyone, from early childhood to lifelong learning. By 2030, ensure that all girls and boys complete free, equitable, and quality primary and secondary education, leading to relevant and effective learning outcomes. So, we hope that the exposure about anemia throughout this video and also during this competition can increase awareness in the community about the importance of health and always taking precautions. Hemoglobin is a protein found in red cells that carries oxygen from the lungs to all other organs in the body. Anemia is a health condition caused by a low amount of red blood cells. The red blood cells are responsible for carrying oxygen throughout the body, and a low count means that the body will lack of oxygen and suffer from a lack of supply. Anemia is typically measured according to the amount of hemoglobin a person has in their blood. The protein is present inside red blood cells and combines with oxygen, changing it into something the cells can carry. The effects anemia has on the body are usually symptoms caused by lack of oxygen. Anemia is believed to affect around 1.6 billion people around the world, with women and people suffering from chronic diseases being the most at risk. Let's look at this dangerous health condition in detail. Causes. Blood cells typically have a lifespan of 100 to 120 days, and about 0.8 to 1% of them are replaced every day inside the blood. Folate, dietary iron, and vitamin B12 are required by the blood cell to mature. Any external or internal factor causing an imbalance in the development of blood cells is likely to cause anemia. Anemia usually results due to factors that may cause an overproduction of blood cells or rapid destruction of them. Factors that can increase red blood cells production include 1. Hypothyroidism 2. Imbalance in iron, vitamin B12, and folate intake 3. Imbalanced production of red blood cells by the hormones erythropoietin. Factors that cause red blood cell destruction include 1. Hemolysis 2. Childbirth 3. Endometriosis 4. Accidents 5. Surgery 6. Excessive uterine bleeding 7. Fibrosis 8. Cirrhosis, and the last one, liver and spleen disorder. Symptom. People with anemia are usually pale and might complain of feeling cold. They can also experience dizziness, tiredness, problem in concentration, and unusual cravings. They can also affect the tongue, causing inflammation. But in severe cases, anemia also can lead to fainting. Other symptoms of anemia are 1. Jaundice 2. Low or high blood pressure 3. Heart murmur 4. Increased heart rate 5. Enlarged spleen 6. Liver 7. Lymph node, and the last one, atrophic glossitis of the tongue. Diagnosis. Diagnosing anemia starts with a medical history and a physical examination. A family history of sickle anemia can make the diagnosis much simpler. Common tests to diagnose anemia include 1. A complete blood count or CBC test to determine the number of red blood cells in the body. 2. A ferritin test to look for iron stores. 3. Test for serum iron levels. 4. Vitamin B12 and folate tests. And the last one, stool test to check for occult blood. Treatment for anemia depends on the cause. In case of a deficiency in iron, folate, or vitamin B12, you might have to take nutritional supplements. In more severe cases, a doctor might prescribe erythropoietin injection to stimulate red blood cell production. In cases where hemoglobin levels are too low, blood transfusions may be required. There's a different type of anemia include 1. Iron deficiency anemia. The most common type occurs when body have low Fa, caused by blood loss, poor absorption of iron, or lack of iron. Some of the symptoms is brittleness, blue colors to the white of eyes, and desire to eat ice or PCA. The next one, thalassemia, genetic disorder. Bone deformities, slow growth, and dark urine are symptoms of thalassemia. The third one, anemia of chronic disorders or ACD. This type of anemia is caused by chronic diseases such as cancer, HIV or AIDS, and rheumatoid arthritis, which can interfere with the body's ability to produce red blood cells. The fourth one, sickle cell anemia. This is an inherited form of anemia in which the red blood cells are crescent-shaped instead of round, making them more likely to get stuck in blood vessels and break down. Specific symptoms include brain crisis, vision problems, and swelling of hands and feet. The fifth one, pernicious anemia. This is the type of anemia caused by a deficiency of vitamin B12, which is needed to produce red blood cells. Symptoms of pernicious anemia may include numbness of limbs, memory loss, and also depression. The last one but not least, aplastic anemia. This is a rare type of anemia in which the bone marrow doesn't produce enough red blood cells and also platelets. Symptoms of aplastic anemia may include bleeding gums, easy bruising, and also skin rash.